do you know about tuberculosis? If the answer is not much, then you're not alone. According to Dr. Melissa Diaz, the Primary Health Coordinator for Central Health Region, the Ministry of Health recognizes that people don't know enough about TB.
A survey was done recently from the Ministry of Health, and they had published some of the results with regards to the knowledge, and it's still not as high as we would want it to be.
Dr. Diaz and Dr. Keisha Westby Leonardo of the National TB Program helps us shed some light on 5 important facts about tuberculosis. Fact number 1. Most Belizeans have been vaccinated for TB through our BCG vaccine given at birth, but as adults, we can still develop the disease.
The vaccination coverage is usually for about 7 to 10 years. So even though, children are vaccinated against TB, this is to prevent the more severe forms of TB in children, such as TB meningitis, etc. So that is, like I said, the coverage is usually about 7 to 10 years. So there is still the risk of developing TB, even if you have been vaccinated, especially as an adult. If you are constantly exposed to someone who has TB, that puts you at a higher risk of developing it. Also, if you're in an enclosed area or living in an enclosed area with someone who has TB, you're also at a higher risk. Whereas if you're in a more ventilated space, the risk is decreased. When it comes to your the status of your immune system. So if you have a low immune system, that also puts you at risk.
Fact number 2. While it is a common misconception that only persons with HIV get TB, it is not the case. Only 1 in 3 persons infected with TB in Belize do have HIV. Others who can be infected are persons with diabetes, cancer, or any other person who has a weakened immune system.
Historically, tuberculosis was seen mainly as in countries with a lot of poverty, overcrowding, etc. Now we look as well at patients with weakened immune system, like HIV positive patients, diabetes. So any disease that weakens your immune system puts you at risk.
Fact number 3. The Ministry of Health records about 100 new cases each year. The number only represents the active cases, as you can have TB and not have any symptoms. This is called latent TB, which means you contracted the bacteria, but it only affects you when and if you develop a weak immune system. The WHO estimates that 1/4 of the world's population has latent TB. Locally, the Belize district records the highest number of new cases.
It's definitely a priority for us at the Ministry of Health, and especially Central Health Region. As I'd mentioned earlier, we are doing a lot of training. We need to detect more quickly as well. So the training has helped us a lot, that every facility now, all the doctors and nurses are able to sensitize patients, do health education, do the testing, and make the diagnosis and start the treatment. We screen businesses that have many people working in small spaces. We screen the Colby Foundation, the prison as well, as explained before, because of the overcrowding as well. These are situations that can allow the bacteria to spread more often. So we tend to as well look at any new cases that we have, and then we do something called contact tracing. So looking at where that person works, where they live, and going out to visit the homes and visit the workplaces and do screening of people that person has become in contact with.
Fact number 4. Tuberculosis is curable. Treatment is available for free, and it requires taking a series of antibiotics for about 6 months. You can be tested and treated for both active and latent TB. Successful treatment depends on an early diagnosis.
While every cough will not be TB or will not be representative of TB, we want them to have this suspicion, at least the clinical suspicion, that a cough that lasts more than 2 weeks, prolonged cough with fever, weight loss, night sweats, you have to think about it. You at least have to rule out tuberculosis. Now the cure rate, we do still need improvement on that, but we are, for 2018, if I'm not mistaken, we were at about 70% cure rate.
Fact number 5. We can end TB within our lifetime.
Along with the SDG goals, we are trying to put an end to TB globally, and Belize is definitely included in that.
That's why the theme for this year's World TB Day is It's Time.
Well, leading up to World TB Day, which will be celebrated on this Friday, March 22nd, we have had a lot of screening activities, visiting schools, visiting workplaces, promoting, doing health education, and just doing an overall awareness and sensitization about TB. There are other things as well for the actual fair. We're going to have at the Battlefield Park on Friday. We're going to have other areas along with us. So we're going to do the screening at the fair, as well as HIV testing, blood glucose, blood pressure testing, and a lot of health promotion in other areas.